Hello friends, my name is Dr. Navneet. Today we are going to talk about the three basic and classic repertorial methods. See, we know that all repertories are different in their different aspects, and most importantly we are having these three main system of repertory or repertorization, namely Boenninghausen, Kent and Boger. We also study in our syllabus, but today we are going to talk about their basic overview about their concept and some aspect of their utility in our practice. So why this repertory are different? Because their stalwarts who made those repertory made it differently with their some background philosophy in their mind. The philosophy about man, philosophy about disease, philosophy about totality. So this philosophy they have imbibed in the structure of repertory, and thus the method to use that particular repertory by that stalwart is different from other. And we are seeing different type of cases in our clinic. Every case present in terms of symptomatology differently to us. So some cases are better worked out with particular repertory than others and better suited. So it is very important to learn these three basic repertorial methods and their conceptual foundation, and we are going to talk about them. Please keep in mind that this video is about a basic overview of this three repertorial system and not a detailed study of them. So this should be considered as a guidance or map to study those repertorial system in detail. First, we will consider the Boenninghausen method or Boenninghausen concept. See, Boenninghausen was in direct connection with Dr. Hahnemann. He is considered as a father of repertory, and he published the therapeutic pocketbook after 10 years of extensive study of cases and materia medica pura. So, in a way, the study of Boenninghausen's method, concept and repertory becomes very essential for student. So we will talk about Boenninghausen's method first. As far as conceptual background is concerned, these points are more important to consider while working out with Boenninghausen method. First is grand generalization. You are generalizing at a grand scale from particular to general. Depends on a case. You need to study this system in detail actually to make it happen. The concept of complete symptom and importance of modality, also importance of concomitant. This points becomes the more important when you are applying Boenninghausen method or using Boenninghausen repertory. Another point is when you are repertorizing any case with Boenninghausen method, we can see the two prevalent method while working out with Boenninghausen. Can be considered as approach also, but technically we can talk on that later on. First is Robert's style of working out with Boenninghausen. He basically gave a simple method to work out with Boenninghausen therapeutic pocketbook, where we need to consider all the locations, sensation, modalities and concomitant together, repertorize them combinedly, and in a way this becomes more of a all-inclusive or mechanical type of repertorization. Further on, Dr. Dhavde modified this style, and he introduced the Boenninghausen's concept in a more improved manner, where we are selecting the important aspect of case definitely with the consideration of Boenninghausen's concept, modality, concomitant and generalization. But we are not repertorizing everything, every location, every sensation and every modality in our case, but we are picking up the important and selective symptoms from the case which are individual. What type of cases are more suited to Boenninghausen method? See, there is one point you need to remember: the well-rounded cases which represents the all type of data in optimum level. Those type of cases are called well-rounded cases, and they can be worked out with any method. This is one thing. Particularly when you are having a good modalities, characteristic modalities, good connection or clear concomitant. You can see important one in your cases, and also a lack of mental data or mental symptoms in your case. Those type of cases are more suitable to a Boenninghausen method. In Boenninghausen method, causation, modality and concomitant are more important, and consideration of mental becomes also important, but at a last stage or differentiation. One more point for Boenninghausen method: preferably which repertory you should use while working out with Boenninghausen method. So at your at student level, preferably you should work out with either therapeutic pocketbook or BBCR. These are the most compatible repertory as far as Boenninghausen's concept or Boenninghausen method is concerned. So let's talk about Kent's method. See, Kent is coming almost after 4 or 5 decades of Boenninghausen. Till then, Boenninghausen therapeutic pocketbook was ruling as the chief philosophical repertory. But afterwards, there were some noise, some opposing noise about the grand generalization theory. The Herring, Kent were among them. Those were not in favor of grand generalization. So they preferred the symptoms as it is. So this was the scenario in which Kent repertory was being developed. So Kent repertory becomes the most popular repertory till then, and the concept which Kent imbibed in this repertory, as we all know, it is quite popular one. Kent was in influence of the Swedenborgian theories and the new church. So he imbibed those concepts in homeopathy also. So we can see Kent is giving the more importance to mind, and the concept of man is connected with the mind. We know that will, understanding and memory. So in Kent's concept, the mind or mental symptoms becomes the most important. Another point is the symptoms which are related to the man as a whole, means the general symptoms are more important than particular. Quite opposing to Boenninghausen, because he considered what is true for the part, it is true for the whole, but Kent consider what symptoms are related with the man as a whole, those can be considered as a general symptom, and those symptoms are related with the parts, they can be considered as a particular, and they are less important than generals. This is the conceptual foundation or the basic conceptual points you need to keep in mind while using Kent's repertory. So in Kent's repertory, I am not going to talk about the repertory or particular chapters in detail, but he gives the importance to mental and generals, and about the generalization. When we are generalizing any symptom, the Kent is strict about the process, unlike the Boenninghausen. So you can generalize any sensation or any modality if it is present on 2 or more locations, and thus it can be called a limited generalization. So there is generalization in Kent's method, but it is a different from a grand generalization process of Boenninghausen. So as far as the method is concerned, we all know that the mental generals are most important, then comes the physical generals, and comes the characteristic particular at the final stage of differentiation in the process. So which type of cases are more suitable for Kent's method? We all know that the cases represented with more of mental symptoms, more of a mind data, are more suited with Kent's method. Cases rich in physical generals are better worked out or can be better worked out with the Kent's method. Or in acute also, you should, or you can refer the Kent's repertory for characteristic particulars also, because it is very rich in the data of the particular. Which repertory you should use while repertorizing with Kent's method? Obviously the Kent's repertory. And it is very interesting to know that all the modern repertories are mainly based on Kent's repertory or Kent's structure, so to say. So the larger modern repertories are also representing in a way the Kent's structure. So you also can repertorize your case with modern repertory which are compatible with the Kent's method. So This was about the Kent's method of repertorization. Now the last important method is Boger's method. Let's understand about Boger himself in a short way. That Boger comes after Kent. He was connected with the German ancestry. So in a way he was having a privilege to understand the German. So he was studying Boenninghausen. At that time the whole fraternity was influenced by Kent's storm. So Boger was well versed and well educated in Boenninghausen method. On the other hand, due to his time, he was also educated in Kent's method also. So he is having a privilege to understand and work out both the method Boenninghausen and Kent. This is one thing. So he gave contribution to homeopathy in form of BBCR. Now let's talk about BBCR. I am talking about Boger in a different way. Try to understand this. So BBCR represents the improvement over Boenninghausen therapeutic pocket book in one way. It also an answer to Kent's criticism about Boenninghausen's approach, because it also represents the general well. BBCR also having the flexibility for the grand generalization as well as the facility for consideration of particular also. So it is having a middle ground between Boenninghausen therapeutic and Kent's repertory. So in a way it is very important work for the Boenninghausen concept. So we can consider the BBCR or the structure of BBCR as Boger's viewpoint on Boenninghausen method, or his viewpoint about repertorization and improvement over Boenninghausen work. This is one thing. Another thing is, after BBCR he is coming out with a Boger synoptic key, which he developed for his own practice. This work is very essential. So it represents his way of working out the cases. So in this way this also becomes the Boger's method, and it further evolved into the card repertory, which is also his own way to work out with the cases. This is one thing. So conceptually Boger gives the importance to the whole pathogenesis of the case and the genius of the medicine or the patient, which means that the genius is like a core of the patient or medicine which pervade the whole symptoms or all of the parts of the medicine or patient. So the consideration of the essence or core or genius or most important aspect of the case becomes quite an important point for Boger concept. And pathogenesis is the consideration of the whole process of disease, either in proving or materia medica or in a case. It also it includes the whole evolution of disease, the way the disease evolves, the pace of disease evolves, the pattern in disease expresses, and the different aspect of pathology it expresses. This was the contribution by Boger in concept of totality. This is one thing. Another key points which Dr. Kashad mentions is the importance of tissue affinity, importance of pathological general, and importance of time dimension in a different way. This becomes the most important aspects to consider while working out with the Boger. I am talking about them, but we need to learn them in a detail before we apply them in our practice. So as far as the application of repertory is concerned, it depends on a case. So when you are having a clear cut essence and a very clear point in terms of very few selected symptom or rubric, then the Boger synoptic key can be better worked out. Even Fatak repertory is very well suitable or compatible with the Boger's approach. This is one thing. When you are having a larger data to work out, then for Boger's case, for Boger's method, BBCR is more preferable. So this was the overview of three basic and classic repertorial systems or repertorial method, and this was my understanding about, we can say, the concept and the method. But this should be considered as a guide or a map to study the repertorial system in detail and not be taken as a tips or direct tips to application. So this was my effort to explain you the overview. I hope it is useful for your application and study. Thank you.